We'll now take leaders' questions under Standing Order 36. Happy to call on the Leader of Sinn Féin, Deputy MaryLou McDonald, please.
The need to build capacity in our hospitals has never been more urgent. Decades of bad government policy has meant our health service was at breaking point ever before we heard of COVID. But now we face the most serious health emergency of a lifetime. Yet, despite what the last 18 months has taught us, there is a real absence of urgency and planning from your government. We need more beds, more staff. We have to dramatically improve diagnostic and theatre capacity. But incredibly, your government has waited until the middle of November to come forward with your winter plan for the health service. Taoiseach, as far back as July, Sinn Féin and others said there was no time to wait. We called for preparations for winter to start at that point and urgently. We drafted a plan, we sent it to Minister Donnelly and we were ignored. Your winter plan doesn't go far enough. In fact, it's built on the failures of your recent budget. Like the budget, your plan doesn't provide for one additional acute bed beyond what was already committed, not one. Nor has it provided the increase in ICU beds needed to meet this emergency. Frontline staff have been left outside hospitals protesting over unsafe staffing levels. But this plan does nothing to improve recruitment for the health service, where it can take up to 6 months to recruit a nurse and a year and more to recruit a consultant. How can that be justified? My colleague David Cullinan has met with hospital managers in Cork, in Sligo, in Galway and beyond, all of whom have capital requests lodged for months, and they are left to wait and wait. And this means that badly needed 50 to 100 bed expansions are delayed and delayed indefinitely. The capital approvals process doesn't work. It's simply too slow, Taoiseach. Even if we hadn't been hit by a pandemic, your plan falls far short of what's needed to meet the challenge faced by our hospitals, even in a normal year. Taoiseach, this should have been a plan for real progress and real ambition, but instead it's a plan for our creaking hospitals to stand still. And the price for this lack of planning and urgency will be paid by patients left to wait on trolleys in hospital corridors. By the way, there are 409 such patients on trolleys today. It will be paid by children with scoliosis and other conditions crying out for procedures that would literally change their lives. Paid also by our frontline healthcare workers who are denied the resources to do their jobs and are left to work in stress cauldron conditions. Taoiseach, ní haon plan an gíomhrí sách fada. Anis an tamcon an cuaram sláinte a all I gheart. Tá níos mó lapacha agus níos mó feirne ag tastal sa seirbhís sláinte uain. Tá stúin prán agus seachada uain. We need a big step forward from government. We need a real change. Taoiseach, can I ask you, do you accept the urgent need to significantly ramp up the number of beds in the system? Taoiseach, will you immediately address the bottlenecks in the capital approvals process so that those hospitals can press ahead with their expansions? And will you act on the call made by the IMO to cut the extraordinary time taken to recruit healthcare staff?
Thank you, Deputy McDonald. Taoiseach, please.
Well, dúspáir ní ein team leis an teachta ó héhan plan atá fáilte ag an Tara Donnelly mar is léir go plan cuimseach agus caithú chéir I ggóhéach san fan a bhí a gcuine norig ina raibh annachchuid áisina agus airgid chutha fáil dus na hospedéal go háirithe agus na seirfisí sráinte go thomláin agus díag an é go héh na lepacha níos mó atá going inis agus níos mó daoine tá ag obair san seirfís a bhd níos mó ag obair inis ná mar a bhí is léir go bhfuil dul chun cín de feiscint ach dar nó sin tá dúchláin anna bhór a bhach roing ní hamháin ó héamh an pandéim ach tá an déanra ag dar an arda agus tá brú fiile na daoine tá ag obair leistigh den seirfís. Could I first of all say to the Deputy, I thank you for your question, But I think, to be fair, if you look at previous winter initiative plans, 40 million in 2016, 40 again in 2017, 10 million in 2018, 10 million in 2019. In 2020, last year's winter initiative plan was 600 million. And that went into the base, okay? So that underpins the efforts we make this year. And that 600 million, along with additional funding, has produced already 800 beds, non-ICU acute beds. That's the largest ever, but by the end of the year, that will go up to about 950 in terms of acute hospital beds. I'd say the largest increase in hospital beds in decades, certainly in the history of the HSE. And we want to do more in 2022 in terms of acute beds. There's a further 205 beds in 2022 committed to and funded, and any additionality that can be brought on stream will be brought on stream. I've spoken at a recent Health Cabinet Subcommittee meeting. I understand fully the issue around capital approvals, and I've asked that that gets accelerated, and I've spoken to the HSE in relation to that. We're going to work with the HSE in respect of capital approvals for new elective facilities, in particular, that we get these delivered as fast as we can. The situation in Ireland in terms of large infrastructure projects, be it hospitals, be it road, be it rail, is it takes simply too long. And we do have to go through all the planning processes, we have to go through all the conditions and so on, but it's simply taking too long to get large projects done. And I'm determined within healthcare that we get major capital projects done much faster. In respect of the winter plan, the initiatives essentially is focusing on a core objective of emergency department avoidance by treating people at home or in the community, by allowing them to return to home following hospitalisation quickly. Those initiatives include GP liaison nurses to manage direct referrals from GPs to emergency departments, geriatric community support, enhancement and expansion of frailty intervention therapy teams, models, community response teams, that's nursing and therapies in the community, community respiratory admission avoidance teams, expansion of the National Ambulance Service Pathfinder initiative, additional home support hours, and COPD outreach teams. In other words, to get to people before they're admitted to hospital in the first place, and then within the hospital to have far better flows than historically was the case. Now that was achieved last year through record home help hours and home care hours, that were provided, up to 5 million. The challenge facing us this year is not funding or not resources, but rather getting the workers in sufficient numbers in the country to take up posts as home carers. That is a challenge. I mean, we've recruited about 4,462 whole-time equivalents in 2021. Last year, it was 6,357 extra whole-time equivalents. So that's giving you about 11,000 in the guts of 2 years, within 2 years, whole-time equivalents recruited. And again, I have no issue with accelerating the recruitment processes. The funding is there. In fact, there was more funding provided, and additional people could have been recruited if the people were there. Deputy McDonald.
Well, Taoiseach, as ever with your government, it's a case of too little and too late. The middle of November is not the time to be producing your winter emergency plan, with the greatest of respect to all of you. That work should have been done in the summer. And the facts are that the mistake made at budget time, where not one additional acute inpatient or community bed beyond what had been previously committed to was budgeted for. You repeat that mistake again in your winter plan. And resources and money aren't everything, but I can tell you, if you talk to anybody working in any hospital across the state, they will give you chapter and verse as to how stretched they are, and the fact that the resources are lacking. We need more beds. We need more acute beds. We need more ICU capacity. We also need the capital approvals process to be streamlined. I mean, what's being held back, for example, 96 beds for Limerick, 50 beds for Sligo, 50 beds for Cork. I could go on and on and on. And similarly with the recruitment process, would you believe me if I told you, Taoiseach, that the average recruit time for a consultant is 562 days and 6 months for a nurse? Now, hospital managers across the state know that this is ludicrous. This is a bureaucratic nightmare, Orwellian in its proportions.
Time is up, Deputy,
so
please.
rather than Ceann Comhairle de Taoiseach simply expressing interest or concern on this, it's your job to actually ensure that it's sorted out.
Time
And
is
these
up now, Deputy,
bottlenecks
please.
and this excessive bureaucracy is cut short. But as to your lack of capacity
time,
in the
Deputy,
hospitals,
please.
I just want to reiterate to you,
please, Deputy, you're way over
Taoiseach, that
time.
the funds and resources have to be made available, and you have failed in that regard. Astonishing stuff.
Just very quickly, since I became Taoiseach, we've had record recruitment to the health service and we've record capital funding provided and a record number of beds provided. But that's not enough. I'm not resting on that. I want to do more. And I do want to accelerate capital programmes. And in some instances, proposals haven't come from certain hospital groups. Right? Yes, haven't come. In terms of, and I was down, I met Cork consultants. And they were taken back in relation to the fact that we said funding is available if you want in the short term to increase bed capacity. So we're there to respond as quickly as we possibly can. But what I would say to people in the, just sorry to the chair, I make my point. I've instance Cork. Also what tends to happen, there's working parties set up. Everybody within various consultants can have different views as to where particular elective facilities are to be located. They all have preferred options. There's too much analysis, which leads to a degree of paralysis, and that's before it ever gets to the department. And that's something I want to cut through. And we are going to cut through in terms of getting badly needed facilities done. But 1,000 beds by the end of this year, more or less, will have been provided. That's the largest ever. You can't ignore that, Deputy, either. That's a fact. And the money is there to recruit more than the numbers that have been recruited. And I have no issue, and I want to accelerate the recruitment processes also. But if I just say, add the recruitment to the vaccination programme that was recruited, to the testing facility that was recruited, it's quite enormous, to be fair to the HSE, and to give them credit.